Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Hip labrum surgery. Is it the right treatment? A hip labral tear can cause hip joint discomfort and pain, and it can be repaired surgically or managed with non-surgical treatment. Surgical repair of a hip labral tear is usually done through a minimally invasive arthroscopic procedure. The decision about which approach is right for you depends on several factors, including how well it's already healing, the type of tear, and whether you have arthritis. /r/n/r/n This article describes the factors to consider when thinking about surgical treatment for a hip labral tear. /r/n/r/n The hip labrum is a ring of cartilage that surrounds the socket of the ball and socket hip joint. Unlike other ball and socket joints, such as the shoulder, the hip has a very deep and stable socket. /r/n/r/n The hip labrum helps to deepen the socket, while also being flexible to allow for some movement. /r/n/r/n The hip labrum, like other types of cartilage, lacks a good blood supply and therefore does not have a strong capacity to heal after damage. /r/n/r/n Once the labrum has been damaged, it tends to show signs of damage that may not repair over time. /r/n/r/n Hip labral tears come in a variety of shapes, sizes, and types, and the treatment can differ significantly. /r/n/r/n Most importantly, labral tears are often seen in the setting of other damage to the hip joint including arthritis and bone spurs. A labral tear in the setting of arthritis of the hip is nothing like a labral tear as an isolated injury. /r/n/r/n But labral tears are very common, and they don't usually cause symptoms. Often, labral tears do not need treatment. In one study, a labral tear was detected in 41 to 43% of asymptomatic hips. Another study found that over 90% of patients age 50 and older had some degree of hip labral tear discovered on MRI. /r/n/r/n Between 1999 and 2009, arthroscopic surgery of the hip joint increased 18-fold, with a 365% increase between 2004 and 2009. /r/n/r/n Arthroscopic hip surgery is an outpatient surgery that is often performed under general anesthesia. During the procedure, a surgeon places a small camera with an attached light source into the hip joint and places the surgical instruments through another small incision. /r/n/r/n Techniques used during surgery may include /r/n/r/n The decision of how to address the tear usually depends on factors including the tear type and location. /r/n/r/n Arthroscopic hip surgery has potential risks. /r/n/r/n When considering any surgical treatment, it is important to weigh the risks and the benefits of surgery. /r/n/r/n A number of studies have reported good short-term results following arthroscopic hip surgery. Most of these studies find that people who undergo hip arthroscopy have good pain relief in the months and years to follow surgical treatment. /r/n/r/n Especially when there are no signs of arthritis, these results tend to hold up well over time, and people are satisfied with their treatment. /r/n/r/n Only a few studies have compared surgical treatment to non-surgical treatment. /r/n/r/n One study of about 100 military recruits who had hip labral tears randomly assigned them to either get surgery or non-surgical treatment. 2 years after treatment was completed, there was no significant difference between the groups of individuals treated surgically versus those treated non-surgically. /r/n/r/n That is not to say that everyone got better, it just means that an approximately equal number of patients got better with non-surgical treatment as with surgical treatment. However, 70% of the patients who didn't have surgery ended up undergoing surgery later. /r/n/r/n. In almost all situations, non-surgical treatment should be attempted before surgery. /r/n/r/n. There has been controversy regarding the treatment of patients over the age of 40 who have labral tears. /r/n/r/n. Studies have shown that people over the age of 40 have a higher rate of progressive arthritis of the hip joint, and the labral tear is likely an early sign of arthritis in the hip. Almost 20% of these patients ultimately end up having hip replacement surgery within a year and a half of undergoing arthroscopic hip surgery. /r/n/r/n. It is clear that not every individual who has a hip labral tear needs arthroscopic hip surgery. In fact, non-surgical treatment in many cases may be just as effective, and sometimes even more effective, than surgical intervention. Working to define which patients are most likely to benefit is an ongoing process. /r/n/r/n. Arthroscopic hip surgery undoubtedly plays an important role in the treatment of hip labral injuries. That said, many patients can find equally effective treatment with non-surgical treatment. In almost all scenarios, non-surgical treatment should be attempted before considering arthroscopic surgery. /r/n/r/n. Studies have shown that when nonsurgical and surgical treatment are compared, the results are not too different between these groups. Both treatments tend to lead to an improvement in symptoms. There are situations when non-surgical treatments are not effective, and surgery can be considered. /r/n/r/n. The ideal candidate for surgical treatment is under the age of 40 years old and does not have signs of arthritis in their hip joint. /r/n/r/n. It depends. Surgery is not always required or recommended for a labrum tear. A person's age, the extent of the injury, and overall hip health are factors to consider. /r/n/r/n. Surgery is not typically recommended for people ages 40 and up. This is because a hip labrum tear is often an early sign of arthritis. If you have osteoarthritis, a hip replacement may be needed in the future. /r/n/r/n. In addition, other treatments, including physical therapy, may be equally as effective as surgery for a minor tear. /r/n/r/n. It can take several months to fully return to normal after hip labrum tear surgery. You can expect to walk with crutches for the first week or two. After that, at least 6 weeks of physical therapy will be needed to help restore strength and flexibility. /r/n/r/n. On average, it takes about 6 months to fully recover after hip labral tear surgery. Some people recover in as little as 3 months, while others take longer to heal. As long as there aren't any complications or other problems with the hip joint, you should be fully recovered within 9 months. /r/n/r/n. In the immediate aftermath of hip labrum arthroscopy, you will not be able to put any weight on the leg for the first week or so. /r/n/r/n. Other things to watch out for: /r/n/r/n. Once you start physical therapy, it will still be a while until you are able to exercise independently. You will need to avoid high-impact activities like jumping or running for at least 12 weeks and not until your physical therapist or surgeon approves it. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.